Welcome everyone. Welcome birth partners. It's great to have you. If your birth partner isn't here, definitely share this with them. I think it's good for the person giving birth to also learn about all of this so that they know what ways they can be supported. So my name is Victoria Tippins and I am a birth educator and student midwife. I've been attending births for 15 years. I attended my first actually about 18 years ago, but I officially became trained about 15 years ago. And I teach my 5-step process to support parents in feeling confident and prepared for birth in my free birth course. The link is in the description. So go ahead and grab that link and hit subscribe so you don't miss any of the videos. Well, let's get started. So I created a 5-step process to support parents in feeling confident and prepared for birth, and it's called the Peaceful Birth Method. And so part of the Peaceful Birth Method is partner support, learning about what ways a partner can support you or support person can help you through birth, both emotionally and physically. Typically, birth partner's role is to provide emotional and physical support through contractions, or if you have an epidural, support with changing positions with an epidural, helping you be comfortable, things like that. And then also with advocacy. So learning how to communicate with providers and invite a collaborative care model rather than just like being told what to do, right? And so we could go over all of these things I'm going to talk about today: emotional support and preparation, physical support and preparation, coping with labor, and advocacy. I could talk about each of those things for at least an hour. So I'm going to pack in as much as I can within our hour. So if anyone wants to do a free call with me and spend an hour with me to really help you kind of map out what are the steps needed for you to feel confident and prepared for birth, go ahead and book that call. And on the call, that out for you and create a custom plan. And then we can also talk about and explore if my coaching program would feel like a good fit for you. So, okay, let's get started. So first, I'd like to begin by talking about coping with labor specifically and how a birth partner can support you in coping with labor. So when a mom is coping with labor well, they follow along this rhythm or this pattern, and it's called the 3 R's. And this was developed by Penny Simkin, who's a well-known doula. And it basically means that when she observed that someone was doing well in labor, which means they were tolerating the contractions okay, they were coping okay, and they were able to have an unmedicated birth if that is what they wanted. They followed along the 3 R's: rhythm, repetition, and relaxation. Rhythm is a thing that you do to help you get through the contraction. That could be swaying, moaning, rocking back and forth, like anything that you're doing to help you cope with the contraction. It could be maybe your arms are over partner and you're rocking back and forth and you're patting your partner's back. Maybe you're having someone do a double hip squeeze on your hips, or giving you affirmations. We're doing a thing to help you get through the contraction. This is so helpful to know because it makes coping with labor so simple, and it makes your support person's role so simple too. So sometimes, especially in early labor, moms will be like, I don't know what to do. Like, what should I do? Like, should I try this position or that position? I don't know what the right thing to do is. Typically, when you get more into an active labor place, contractions will feel more intense, and it will be often not very voluntary, like I have to get on the floor and hands and knees, or I have to rock back and forth on the birth ball. This is the only thing that's working well for me. But most of the time in the first or like early stages of labor, moms are getting contractions and need to do something about it, and they're just not sure exactly what to do. And that just means they haven't found their rhythm. So we just need to try different things to help them find their rhythm. Also, when we progress further in labor, it's possible that a mom might feel like, I can't do this anymore, or I'm having a really hard time in this rhythm that I'm doing. Whatever I'm doing that was working before, it's not working now. Help, I'm really struggling. Probably that means you just need to find a new rhythm. Your rhythm isn't working anymore, and now we need to find a new one. Understanding the 3 R's makes your role as a support person so much easier. So let's first start by talking about rhythm specifically and the things that you can do to support the rhythm. So when you have your rhythm, or when the mom has the rhythm, they're going to do a thing to help them get through the contraction. And so you can provide at that time either emotional support, or you could provide physical support, or both. It's also possible that you might be sitting on your hands, and that can feel pretty hard for some people to watch the person they love go through an experience that's clearly intense, and you want to do something about it, and there's nothing you can do. Physiology is just working, and the mom is doing their thing, and they don't need you to talk to them. They don't need you to touch them. They're doing good. They just want you to be there. And so sometimes supporting the rhythm is really just choosing to honor physiology and to just be present. So I invite you as a support person to recognize that your role, first and foremost, is not to be doing a bunch of stuff. Maybe you will need to be doing a bunch of stuff, but really the foundation of it is for you to be present and in love with that person, feeling love for that person, just present and connected to love. You already know how to do that. You know how to love the person who's bringing your baby into the world. And so if you can just be present with them, which means you're not on your phone, please don't be on your phone, playing games, whatever. You're like here in the moment, you're witnessing what's going on, you're calm, you're taking care of your own needs so that you can show up and take care of the person who's giving birth. And also, you're feeling love. So I invite you to feel love in your body for the person giving birth, and feel that love and just have that feeling intact in your body as they're going through the experience, and just be present with them. It's really quite simple. The ways that you can support a rhythm in a more hands-on way if someone is needing that support would be physical or emotional. So let's first talk about physical. So physical support through a contraction often looks like doing a thing physically, right, to support the mom in being able to get through that contraction. So maybe for their rhythm, they need you to help them some way. For my third, I could not tolerate a contraction unless I had my arms wrapped around somebody and I was holding onto somebody. And I would have either my doula or my husband or both of them wrapped with my head like in their chest, like I'm holding onto you. And I needed that. I needed to feel like hugged and held and like I could squeeze onto somebody. And that physical support was my rhythm. I couldn't imagine doing it without it. I needed that so much. And with my first, my husband just sat in the corner and I was like, leave me alone. I just want to be like a wild animal in the corner of my room in the dark, having my baby, and I don't need anyone touching me. So we never know exactly how we're going to feel. But, giving that person some kind of physical support can often be helpful if that's what the mom needs. So sometimes that looks like being a prop. So you are helping the mom be in an upright position, for example. So maybe the mom wants to stand and rock side to side during a contraction. And it's hard to hold yourself up when you're pregnant and you're having a contraction. We kind of need to lean into something or have someone kind of hold our body weight. So let's say that you're standing and then your partner, the mom, is standing in front of you and has their arms around your neck maybe, and it has head against your chest and it's like this, rocking back and forth. And you're just holding their weight a little bit, rocking back and forth, maybe rubbing their back or having firm pressure on their back while they have the contraction. And maybe that's what the rhythm is and how you're offering physical support. Another way that you could also offer physical support is through massage. So body work is very common in many different cultures around the world, offering consistent massage all throughout birth. Releasing tension in the musculature around the pelvis can really help the pelvis access more mobility. So if we can do a little bit of massage around the thighs, around the booty, around the low back, that can sometimes feel good during a contraction. And that kind of touch or massage, I don't have a specific technique to teach you. I would touch the mom in whatever ways the mom likes to be touched. And you will know that if this is your partner especially, you should know how they like to be touched. And I think it's good to have a conversation around this too. What are the ways that you like to be touched? How do you imagine me supporting you in labor? How do you imagine me touching you? And the mom might say like, oh, that thing you do on my back, it feels so good, just to get that clarity around that touch, I think can be really helpful. There are some specific ways that you can support physically in addition to just like general massage, intuitive massage, which means you're touching their mom and giving them some massage in whatever way feels good for them. And that would be to do the counter pressure and the double hip squeeze. So let's first talk about counter pressure. So on the back of the pelvis, there is this bony structure and it's called the sacrum. And so the sacrum is the part of the pelvis that will move back a little bit as the baby descends down. So as the baby is engaging in the pelvis and they're moving all the way through, this back part back here, they're going to put a lot of pressure back here. And for some moms, it doesn't bother them very much. And for other moms, it feels really really uncomfortable and they feel a lot of discomfort in their back. And we don't know exactly how your birth is going to go until you're there. So having some skill and tools around back support is really helpful. So one would be to directly put your hand on the sacrum. So what we want to do is we just want to take our hand, just a flat open hand, and place it right on the low back. You can feel the back, the low back of the person giving birth or the pregnant person, and you'll feel these bony structures here on the sides, and you'll be able to tell like, okay, that's where the sacrum is. You can feel on each side there's like this bony little point sticking out. So it'll also bulge out a little bit. There's a little bit of a curve. So what I like to do is I like to cup that curve with my palm of my hand right over the sacrum. And I just push directly inward. And that's all you have to do. It's just a gentle push in. What I recommend doing in addition to the push is just a little lift up, ever so slightly. So you're going to push and then lift up. So apply your fingers and just have your fingers move up ever so slightly. You don't have to really like push upwards, but just have a little emphasis on up, if that makes sense. And the reason why we do this is because when we help support the back of the pelvis and lifting up a little bit, we're actually opening and widening that part of the pelvis. That can take pressure off. It can help with fetal descent. It can help with labor progress and can also really help with pain or discomfort in the back. The next one that I want to teach you is the double hip squeeze. This is a very common position for partners to learn, and this one can feel so good for moms in labor. So basically what we want to do is we want to come on each side again of the sacrum. And so you can feel your fingers. I usually feel it first and I'm like, okay, where is your sacrum? Okay, I found it. Cool. I feel these bony parts on each side. So then what I want to do is I want to take my hand and put it to the side of the sacrum, just like this. And then the other hand as well. So what it looks like, you want to take your elbows out, fingers together, and then point. So it's kind of like the sacrum in the middle is being framed around these fingers, if that makes sense. So you're not on the sacrum, you're just around it. And all you do is push together and do a gentle lift up. It's actually very simple. You just got to feel the low back and find the sacrum and say, okay, I found it. I'm going to put my hand on each side and just push together and gentle lift up. Some partners are very strong people with big muscles and they will easily be like, and it's like very intense. Sometimes during labor, moms really need you to push super hard, and that's really helpful. Other times, moms want it to be more gentle. So I recommend starting gentle and just communicating. How does this feel? Does this feel like too much? Not enough? And you'll kind of gauge what feels good. And if moms want more, they'll usually just say like harder or more or something like that when you're pushing to indicate like, okay, I need to push a little bit more. This is why having a doula can sometimes be helpful, because if a mom is wanting a lot of that pressure on her back for every contraction and needs that, you might not be able to go very far. And it might be a little exhausting to your arms. So sometimes having a doula can be helpful, but partners are strong and they can do it too if that's what's needed. So that is the double hip squeeze. With the counter pressure and the double hip squeeze, it's important to recognize that when we're doing these things, the person giving birth will probably be moving. So they'll probably be like swaying back and forth or something like that. So let's imagine maybe we're at the hospital or the birth center, or you're at home. You're near a bed, right? There's a birth ball, and maybe we put the birth ball on the bed and mom is leaning over the birth ball, standing like that. It's a great way to stand during contractions and like move side to side. To have you upright without you having to like hold yourself, because the ball is taking a lot of your weight. So mom is like this, rocking back and forth during contractions, kind of bending their knees. And they say like, do the hip thing or do the squeeze or whatever. They might just shout your name, Nicholas. That's like me with my husband. His name's Nicholas. I'll just be like, Nicholas. He knows like what he needs to do. So what you need to do then is move with the mom. So we want to do the counter pressure. And I, as a birth worker who does not have very muscular arms, use two hands and I'll push like that. But a person with stronger upper body might just need to use one. So I'll do counter pressure and then we're going to rock side to side. We're rocking and that's what we're doing. Or maybe double hip squeeze and we're rocking side to side. Yeah, that's a double hip squeeze and the counter pressure. Sometimes moms get a little shaky. It's called the labor shakes. It's normal. It's because of hormone surges in your body, changing physiology and progressing labor. Getting the shakes usually means that your labor is progressing quickly, which is great, or progressing well, or maybe even you're getting close to pushing. Sometimes shaking is a sign you're getting close to pushing. That can feel a little overwhelming and destabilizing. So having someone who can take their hands, put them on your hips, just on each side of the mom's upper leg, right? And just squeeze together. Sometimes that can feel stabilizing and supportive. So that's another trick that I wanted to offer. Let's see, for physical support, I don't think there's anything else I want to share for that. So let's go into next, emotional support. Emotional support for the rhythm specifically. When someone is giving birth, the best way that we can support them is to help them to feel safe and to feel connected. Those are the two things I want you to think about. Safe and connected. How can I feel safe and connected? How can I support my partner in feeling safe and connected? I would have a conversation with your partner before labor. What are the things that help you feel safe and that help you feel connected? And write that down and just like have that conversation so you have clarity around like all those different things they might be able to say or incorporate to support that mom in feeling that way. So sometimes when moms are struggling, they just don't feel safe or they don't feel connected. It can kind of feel like I'm just closing my eyes, I'm doing my thing, and I'm kind of lost in my own world right now. And having the mom open their eyes and look in your eyes can be such a game changer. And I remember with my first, I was like getting to transition, which is that hardest part of labor typically. So moms snap through transition and it's the easiest part. For me, with all three of mine, it was the hardest. And I felt like, I don't know if I want to do this anymore. And then my husband, I actually think that I had said, look in my eyes, because I knew that I needed that. So he looked in my eyes and I said, ooh, with me, because I was making these ooh sounds. So he was like making the sounds with me, looking me in the eyes. And that was so helpful. And the sensations changed completely with the intimacy and the connection. I was interpreting my sensations much, much differently compared to how I had been interpreting them up until that point when I was feeling a little bit more alone. And sometimes we need to just be like left alone. But I was getting to a point where I needed to feel safe and connected to get me through it. And so I realized that and I vocalized that. Then I felt like love was bursting through my body. It was beautiful. It was one of the most beautiful experiences of my life. And it wasn't painful. It wasn't pain. It was just intense. But it was that intimacy and that connection that helped me to transcend the pain. I really wasn't in pain when I was looking in his eyes. I just felt like so much love is how I felt. It was so cool. It was such a beautiful experience. So eye gazing is a really excellent way to support. The next thing you can do is give any kind of affirmation. And if you were to work with me in my coaching program, this is where I can help you uncover specific things that can be like, that are personalized to you for around emotional preparation, because we want to build associations to affirmations. We want to practice controlling our attention and putting our attention deliberately again and again on a feeling in our body of what it is that we want, and have a plan how a partner can provide that emotional support and affirmation in a way that's personalized to you. So like with my second, I was stuck on the bathroom floor and I was in transition again. Hello transition. And I was like, I can't do this anymore. And I told my husband, like, I really don't think I can do this anymore. And he wasn't quite sure what to say. And I said, tell me life is worth it. Just tell me life is worth it. And that helped me so much, hearing that life was worth it. And I had this kind of whole thing about life is worth it in that pregnancy. That was a phrase or an affirmation that I had been practicing. I had built a relationship with it. It meant something to me. And so when my husband said that, I was like, oh, okay. If this is what I have to give in exchange for the gift of my child, I can do this. I'm going to be okay. That just changed the game for me. And as a birth worker, if I were to be at a birth and I were to say like, hey, life is worth it, they'd be like, what are you talking about, Victoria? That means nothing to me. So we want to take a personalized approach and build relationships with affirmations. I recommend having a list of all the things that feel really personal to you and your partner. putting it on your phone, like taking a screenshot of a note and making that your wallpaper on your phone as the partner. So you can like look at that and remember those things. For my third, I needed people to hold me and also just say, your body knows what to do, you're safe, whatever, affirmation after affirmation. When I was focusing on the affirmation, I could get through it. When I wasn't hearing the affirmation, when they weren't speaking, I felt like I'm not okay. So it was the affirmation that became my rhythm. So that's another way we can provide emotional support. The eye gazing, the affirmations. You can provide emotional support with touch as well, helping someone feel like they're not alone, you're with them, they're connected to you, right? Touch is a really great way to do that. You can also pay attention to the environment. Does this environment evoke, I'm not from that generation, but I'll say, like, is it giving, right, spa vibes? Because if it's not giving spa, then maybe we should fix that. Because if you are in an environment that feels stressful, that's not very emotionally supportive. We want to create an environment where you feel safe and connected. So partners can just kind of keep an eye on like, are the lights super bright? Could we like put on a playlist of music that you really love? Maybe I could try to limit disruptions when that person comes in the room wanting to do a cervical check again, even though I know this, like the person giving birth really doesn't want cervical checks. Maybe like I'll just like do a better job at declining that on their behalf because they told me they don't want that, for example. Try to limit disruptions, right? So kind of paying attention to the environment is very emotionally supportive too. And then, yeah, actually that's it. That's all I wrote down on my list for the rhythm. So next, let's talk about repetition. Repetition means whatever the heck you're doing to get through your contraction, do it again and keep doing it. And don't stop doing it until it's not working for you anymore. We want to continue and to repeat the rhythm again and again and again until you hate it. And as soon as you're like, oh, now I hate this thing, it's not working for me, cool. That means your labor is progressing. When you feel like this thing isn't working anymore, that means that your labor is progressing, your baby's descending in your pelvis, you're feeling new sensations, and maybe lying on your side with your leg up on a peanut ball on the hospital bed or sitting on the toilet or whatever you were doing that was working for you before is not working anymore because you're getting new, lower, different sensations as labor progresses. So that's a really good sign. What happens though is that moms are like, I don't think I can do this anymore. And like I said before, we just need to find a new rhythm. Sometimes for a mom planning an unmedicated birth, an epidural or pain management, there's nitrous, IV opioids, and the epidural. Sometimes that is the right choice. But most of the time for someone who is wanting to avoid an epidural and they feel like they can't do it anymore, they just need to find a new rhythm. So that would be a good time for you to realize, okay, repeating this rhythm and supporting and repeating the rhythm actually isn't the right thing to do anymore. And instead, what will be the most supportive is if I could help you find a new rhythm, and we're just going to repeat the new rhythm until that doesn't work anymore. And that's what labor is. So we've been on the toilet for a while, maybe sitting backwards on the toilet with a pillow, leaning backwards, right? Partner is like rubbing your back or rubbing the mom's back, applying the counter pressure, something like that. And now mom is like, it's getting too intense. Okay, what if we get in the shower? Do you want to have the water hit your back for a little bit? You want to try that? Do you want to get in the tub? What if we try, like mom is like, I'm so tired. Like, what if we try lying on your side in the hospital bed or on the birth bed or wherever you are with your leg up on a peanut ball and rest a little bit? Do you want to try that? I could still do the counter pressure on the side. I can like lie next to you and like, do the counter pressure while you're lying on your side. We just want to find a new thing. I also want to bring up repetition to invite you to just pay attention to how can I support this in continuing? Because often what happens in an unmedicated birth is that a mom is like, I found my thing and I'm coping well and I'm doing well while I do this thing. And then someone will come in and be like, I want to break your water, or I think you need Pitocin, or I want you to get a cervical exam. And we'll talk about advocacy a little bit in a moment. But if that is happening again and again and again, it's going to feel really disruptive. And a risk to a cervical exam, for example, is that it can throw you off your rhythm. And now you have to get back into the rhythm. You got off of the floor and now you're on the bed, for example, and had to do an exam. And now you're thinking about the number and maybe that like broke your confidence. Maybe it was helpful to hear, but that's a risk to be aware of. And now we need to try to get back into the rhythm. So focusing on repeating the rhythm by avoiding disruptions, protecting the space from unwanted disruptions, advocating for more time if someone wants to do an intervention and the mom is not wanting that intervention in the moment. All of that can be helpful. Also looking for physical sustainability. Can you continue to be in your hands and knees on the bathroom floor for very long if you don't have a towel or a mat or anything under your knees? Probably not. So maybe as the partner, if you see that mom is like, I'm going down to the bathroom floor, like me with my second, and that is where I'm going to be for a little bit and I cannot move. Okay, that's cool. Can I just scoot a towel under your knees? Or take a pillow and put it under your knees. We want to just think about supporting the mom and being able to repeat that rhythm. And then the last is relaxation. A lot of moms make this mistake, which is that they learn all the external coping tools for being able to cope with contractions, and they're preparing to cope with contractions. But who is giving you support in preparing for relaxing? What is your relationship to relaxation? I teach frameworks and practices to help you in my coaching program learn how to relax different muscles, and so that you're able to practice and then integrate and then apply in birth. Not like, oh, I remember I have to relax, but I've practiced relaxing. I have tools. I have a pathway. I built associations. I'm going to be able to relax, and I feel confident in that. Not like, I hope I remember to relax, right? And so that's something that can be really helpful with prep. For a birth partner, I want you to think about, I'm supporting them in their rhythm. I'm supporting them in relaxing in between the rhythm. So when the rhythm is over, now we go into relaxation. So maybe the double hip squeeze or whatever you were doing to help the mom through the rhythm, or the emotional support through the rhythm, we don't need to do that anymore. Now we need to support the mom in relaxing. So you might need to be doing a completely different thing. So you can provide, once again, emotional and physical support for relaxation. So let's start with the physical. Physical support for relaxation looks like taking your open hands and stroking down on someone's back. That can feel so good. It's like, relax. Any kind of touch that specifically helps that person feel relaxed, you can do. You could also do something called the jiggle. So you take your hands, open hands, put them on the mom's thigh and shake back and forth like this. We want to jiggle your thigh, because the more we jiggle the thigh, the more we're able to release tension in the musculature all around the pelvis and support you in having soft and flexible muscles. Because when your baby is descending, if they're coming up against tension, it will make labor longer and labor more painful. So we want to fully relax. We want to fully take your rest and enter the next contraction from a relaxed place. That's so important, because if you are feeling tense and you're tensing up in the presence of the next contraction, that will make the next contraction painful, more painful than it has to be, and also probably less effective because we're fighting against it. So you need to conserve your energy and take your rest. So partner, what you can do is take your hand and do the jiggle, take your hand and do a downward stroke, or any kind of other physical support massage that can release tension and help the mom to relax. Next, let's talk about emotional support for relaxation. For emotional support, you can say things like, that contraction is over. That's in the past. You don't have to think about that one anymore. Let it go. That contraction's over. Take your rest. Take your rest, right? Take your break. Inviting the person giving birth to be present in the moment. We don't need to think about what's coming. We have no way to know how many contractions you have ahead of you. It is impossible. I have attended births where the mom was 9 centimeters for 9 hours. I've attended births where the mom was 3 centimeters and had her baby in 25 minutes. There is no way to know how much longer labor is going to be. That is a hard thing for many people to grapple with. And for you too, as a partner, you are also in the unknown. You're going through this portal, kind of, where you don't know how long we're going to be doing this. And so all we really got to do is just be present in the moment. We're going to do our rhythm. We're going to relax. We're going to do our rhythm. We're going to relax. And eventually a baby's going to appear. And until then, we're just going to do our rhythm and we're going to relax for as long as we need to. And that's what we got to focus on, being present in the moment. So take your rest. You could also offer any kind of emotional support that the mom likes to hear that can help them feel relaxed. Sometimes saying jokes can help the mom relax. If the mom and you have like this relationship where you make her laugh a lot or you make them laugh a lot, and that kind of makes them feel relaxed. My births, I just wanted silence and ceremony and reverence. And I was like, basically my birth plan was like, shut up, shut up, shut up, be quiet, stand in the corner, leave me alone. I don't want any of that. But some people are like, be silly, joke, like make me laugh. There was a mom I supported one time who on her birth playlist put wet ass pussy because she's just a hilarious person and she thought that would be so funny. And that's what we were doing. And we were kind of like telling jokes and being silly and laughing. And that made her relax. That made her feel good. So what makes you relax? And we want to provide that support to help you feel relaxed in between the contractions so you can really take your rest. Everything I wanted to cover for coping. If anyone has any questions, you're welcome to drop them in the chat. And now as we're about halfway through our time, so let's jump into advocacy. So transitioning into advocacy. Advocacy is about communicating what you want and what you don't want to a care provider. Advocacy is saying what you want and what you don't want. And it is very common to enter a model of care where there's a wide evidence practice gap, where decisions are made for you before you even walk in the room because of algorithms and policies that are made by people who work higher up in the hospital, who have profit and liability to consider when making these choices and creating these policies. And everyone's different. The midwifery model of care is way more personalized. Having a midwife out of hospital probably give you more informed consent dynamic just off the bat. And even if you're in the hospital, with a hospital that doesn't really practice informed consent, because some of them do, you can still create an informed consent dynamic and still be collaborative in your care. But it's important to recognize that not every hospital system, not every provider, even midwives, not everyone is going to hand you a informed consent dynamic, a collaboration dynamic where you are part of the decision-making process and you make shared decisions with your provider. It is very common to just be told what to do. And sometimes not even by the provider. Sometimes you don't even see the provider until your baby is about to come out. And so maybe a provider will, talk to the nurse and then say, I want the mom to start Pitocin. And the nurse will come in and say, hey, the doctor says they want you to start Pitocin. And maybe you're like, I don't really want Pitocin. The nurse is like, calls the doctor and is like, well, she doesn't want Pitocin. And the doctor's like, well, I said she has to have Pitocin and her water's been broken for a while. And so she could get an infection. So we need to speed it up. So go tell her that. And then the nurse will tell you that. And then you're like, I still don't want Pitocin. And the nurse, it's crazy. So that can happen sometimes. And in that model, in that approach, what's happening is that we're birthing in a model of care where the provider just wants to tell you what to do and expect that you're going to do that thing. You're going to follow along the policies and algorithms. And it's important to recognize that you have the legal right to do whatever the heck you want. And also, medical providers have training and medical expertise that is necessary in the birth space, absolutely. And they are limited by non-evidence-based, profit-oriented, liability-oriented policies. Hospitals make 2 to 3 times more money when they intervene. And that's just the way it is. And we're in the business of, in a business, right? It's not just about healthcare, it's about making money in many places. So it's just helpful to recognize that. And I invite you to, as the support person, to just have so much compassion for healthcare workers. Even if someone doesn't really seem like your vibe or you're not loving them, you can always request a new nurse. But I want you to approach it from a place of kindness and open-heartedness and vulnerability. It would mean so much to us if you could help us with this thing. I tell them your fears. I'm really worried about someone telling me we have to do something and then I won't know what to do or how to support this person giving birth or my wife or whatever. I'm just worried about that. Tell them what your fears are and be vulnerable and honest. And some care providers, I would say most, are really kind people that want to do their best and they're working in a very limited model where they don't have a lot of time with people and it's harder to take the time to really get to know you and answer your questions, but they want to do their best and they want to address your fears. Every once in a while we can find a care provider or cross paths with a care provider who is actually abusive. And obstetric abuse is a real thing and it happens way more often than it should. And so it's important to be prepared for that too. So let's kind of talk about navigating care providers and ways that you can advocate to have a good team. So when you first get there, I recommend that you bring your birth plan. If you're in my coaching program, you will have your birth plan built for you with me. If you're not, you can build it on your own. When you bring it in, I would recommend handing it as the support person, handing it to the nurse and saying, hi nurse, I'm Tyler. Here's my birth plan, or here's our birth plan. It would mean so much to us if you could help us make these preferences be intact. maybe go over it a little bit. You see right here how she says she wants an unmedicated birth, don't suggest pain medications, or she wants an epidural, but she wants to be the one to say she wants it. She doesn't want it to be offered. You know, see how we're choosing provider hands off. We really want this or that. Just kind of like go through a few of those important things. And if the nurse is like, I don't really like supporting people in upright birth or whatever, I don't like supporting upright positions. That happened to one of my students not too long ago. And she was like, I'm getting a new nurse. We want to figure that out before you're pushing, because we don't want to be in a situation where you're pushing in an upright position, which is your human right. And then someone is like, get on your back. So we want the nurse to be your sidekick in advocacy. Your nurse should be there to help you as the birth partner, to help you advocate. So think of them like that. Someone who's going to be on your side, not someone you have to fight with, someone who's going to be aligned with you, who's going to support you. I recommend checking that out. And if you're like, okay, this nurse isn't a good fit, go to the nurse's station, say, hi there, can I speak to the charge nurse, please? And charge nurse comes out and say, hi, I feel like it's just not a good fit with this person. We really want someone who can support us in an upright birth. And as she just made it clear, she doesn't really feel comfortable with that. Is there like another person that we could have as our nurse? Can we please trade a nurse, or can we exchange? That's a weird word. Maybe I wouldn't say exchange, but can we please request a new nurse? Can we get a new nurse? And if you could get a new one, that would be amazing, because now you have someone hopefully who's just like a better fit for your family. You do have the right to do this. It is very common. So I don't want you to feel like it's a weird taboo thing. It's very common to exchange a nurse and to have someone different be there if you feel like it isn't a good fit. The other thing I want you to be aware of is that some hospitals on their hospital bill of rights will allow for you to even request a new provider when you're in labor. And this is something that is good to know. If you have a big rotation of OBs and you're not quite sure if you feel comfortable with some of the OBs that are there, or you're kind of worried about them not being very kind or whatever, it's good to just look into that and know like, okay, that's a right that I have. So if we have to exercise it, we can. And we can go out to the charge station again, the nurse's station, and say, hi, charge nurse, could you please help us request a new provider? I'm not feeling safe. My wife or my partner is not feeling safe in the presence of this person. And we know that we have the right to request a new one. Can you help us, right? So you can get a new provider in some places. And I think it's good to know that. Let's talk about some communication tools to support you in being collaborative in care. So first, let's talk about if the labor is slow. We're going to talk about 3 different categories: slow labor, C-section, and delivery, episiotomy, that kind of stuff. So first, let's talk about a slow labor. In the 1950s, Dr. Friedman performed non-consensual cervical exams on 500 white women in a hospital in Boston. And then he was like, okay, I've discovered how quickly someone should be dilating in labor. And the world said, oh, we agree with your labor curve, which is crazy. It was not until 2014 that ACOG updated their guidelines saying that you actually have longer to dilate in labor than we originally thought. And so there is not a cutoff. There is not one time that's like, you're in labor too long, time for a C-section. It's kind of more about looking at the full picture. But hospitals sometimes have profit-oriented policies that say we want to get you in and out faster because we'll make more money that way. And so we prefer that at a certain time, like you have a C-section, right? And so your provider might recommend that. And that might be the right choice for you. And I'm not saying that's not the right choice. But I do have students, I had 2 students recently both avoid a C-section because they knew communication tools to navigate that conversation and how to advocate for alternatives. And I could go really deep. I could spend an hour talking about Pitocin. So we can't talk about all that, but I just want to give you a little bit with the time that we have. So if a provider comes in, your labor is progressing well, the mom is feeling good, but all of a sudden someone's like, I think it's just taking a little too long. You've been at 6 centimeters for a couple hours and nothing has changed, right? I think that maybe we should talk about a C-section. If the parent feels like, oh, that's something I really don't want, then maybe you could have a conversation with the provider to open up options. And so what I invite you to do is use this tool called BRAIN. It's an acronym. I'm going to teach it to you. You will probably not remember it all. You probably won't memorize all of it. So please quiz yourself later or quiz yourself with your partner so you really remember this, because this is one of the best tools that you can use. So B, what are the benefits? What are the benefits? Or to maybe like getting Pitocin or whatever the provider wants to do to speed up your labor. They'll say like, well, Pitocin will make your labor faster. That's a benefit. Okay, what are the risks of Pitocin if we're going to maybe talk about that topic? And they should tell you the full risks of Pitocin. They might not. I did see this conversation play out recently, and a provider said, it's your body's own natural oxytocin. There aren't any risks to it. That's a lie. Are risks to Pitocin. It can make your contractions more painful. It could lead to your contractions happening too quickly, a uterine tachysystole. It can lead to your contractions spacing out actually, and your uterus not becoming responsive anymore because the oxytocin receptors become so saturated with Pitocin or with oxytocin. And so that can increase the risk for hemorrhage. And then also it can cause your nipples to flatten and you to hold edema or swelling. And that can cause nursing to be a little bit harder. So that's like a quick overview of the risks of Pitocin. So they should go over that with you. If they don't, you know that now. And this is why it's important to independently educate yourself. And in my coaching program, you will learn this, the full comprehensive risk benefits alternatives of all the options, so you have the education. What's important is that you understand the alternatives. So what are the benefits? What are the risks? What are the alternatives? That's A. And the provider might say, oh, there aren't really alternatives, like Pitocin's what we need to do. Or maybe they'll bring up some alternatives. I just don't know. It depends on that provider. But if you independently already know, then you can bring that up and advocate for that option. What if we use a breast pump? Breast pumping can get the labor to pick up a little bit. What if we release her own oxytocin? What if we get in the shower and do skin to skin and y'all can leave us alone for a little bit, right? Maybe we could do that. Or what if we do position changes? Have we done a cervical check specifically to look for the baby's position? If so, is there a positioning issue? And if there is a positioning issue in my coaching program, this Saturday I'm actually teaching a training in there for my ladies on what to do to resolve a positioning issue. So if you could learn about that and we discover the baby is actually tilted a little to the side, or they're facing forward, or they're in a position that's not putting good even pressure on the cervix, right? The baby's head isn't well applied, then maybe we should do the specific positions to fix it, and we can fix it. And that is such a great skill to have and knowledge to have. And maybe that's why it got slow. So if you got Pitocin, you'll just force the baby down lower in your pelvis in a non-ideal position. So understanding alternatives is so beneficial. The next is I. What about intuition? How do I feel about this thing? What does your intuition have to say? That is so important, that you connect with how you feel and how the mom feels about that choice. In the presence of this choice, do I feel like my throat feels tight, my chest feels tight, my belly hurts? Maybe that's not a good choice for me. Or in the presence of this choice, do I feel more relaxed and okay, maybe that is a right choice for you. And the last is, what about nothing? So that's N. What if we do nothing? Ask the provider that question. And they might say, oh, well, then I'll just check back in with you in a couple hours. Okay, cool. Sometimes providers say, there's a problem, you need to fix it my way. And then we're like, there's a problem, we got to fix it. But maybe it's not a problem. Maybe it's just a failure to wait. Maybe it's coming from a non-evidence-based policy. And maybe just giving you more time is all that's needed. And you don't have to do anything about it. So it's important to explore that option. I recommend after you go through brain and you ask these questions and have a conversation, then you say, okay, thank you for this information. Could you please leave? We're going to spend just a few minutes thinking about it and talking about it. We'll let you know. And then you can send your doula to let them know. If the nurse comes in, you could just say, hey nurse, we decided we do or we don't want the Pitocin. Or you could go out and find the provider yourself and tell them. So that's a really great tool to have. Next, let's talk about a C-section. So there's intermittent monitoring and continuous monitoring. Intermittent monitoring, which I can't talk about too much right now because we don't have the time, but it is a safe and evidence-based choice for low-risk people that decreases your risk for a C-section. Continuous monitoring, where we listen to the baby all throughout labor, is only necessary for high risk, and gestational diabetes isn't high risk, and being over 35 isn't high risk, more like a high risk situation where the baby's heart rate could go down more quickly. Like if you have Pitocin, for example, in your system, because that was another one that could cause fetal distress that I forgot to mention. I was doing a really quick overview of that. Yeah, so let's see. If the baby is being we're listening to the heart rate all throughout labor, there's a normal variation from 110 to 160. And the baby you have a contraction and maybe the baby's heart rate goes down a little lower than it normally does and then goes back to baseline, or goes down, or maybe takes a little bit longer to get back to baseline. And the provider might look at that and say, I think there's a problem. And maybe the baby's not tolerating labor well and we should do a C-section. So that's why continuous monitoring increases your risk for a C-section, because if you're listening continuously all throughout labor, you might notice that normal variation might look a little bit concerning, even though maybe it's fine. And one provider might look at that and say, that looks concerning. And another provider might look at that and say, that looks totally normal. So it opens up the possibility for a false positive to happen. If this were to happen to you, it's important that you understand communication tools and language so that you can have a conversation with a provider and advocate for your preferences and be part of the decision-making process. So instead of someone saying, there's a problem and we need to fix it by doing a C-section, you could say, okay, thanks for the suggestion. What's going on? Like, let's have a conversation about it. And ultimately, you and your partner, be the one to make the decision with the care provider, instead of the care provider just saying, we're going to do it my way. And you're like, okay, I guess we have to do that thing. That's when parents often feel pressured. So we just want to ask questions to begin a conversation and to initiate collaboration. The language to use with this specifically is, okay, is the heart rate reassuring? Are you reassured? That's the language. Or are you not reassured? Is it not reassuring? Or are you not so sure? Are you just not sure? Those are the three different categories a provider could be oriented around in terms of their interpretation of the heart rate when they come in to talk to you about it. And if a provider says, I'm not reassured, I'm really concerned, I think a C-section is really important, that's a different conversation. But if a provider says, I'm just not sure, but I'm kind of leaning towards, we're going to lean towards a C-section for liability purposes. So if you're clear, like, okay, is this a medical emergency or is this not a medical emergency? And they say, well, it's not a medical emergency, but we should do something about it. Okay, let's go through brain, because now we have the opportunity for some alternatives we can talk about. Can we do an amnio infusion, which is a tube that you can put past the cervix into the uterus to basically fill the uterus with fluid, and that creates a barrier around baby's head, and that can really help with their heart rate. What about getting in an upright position? Hands and knees specifically can really help resolve a heart rate issue, right? So what if we do these things? Can we try these things? Those things might not be recommended. One of the moms in my coaching program who just a couple of weeks ago avoided a C-section, she was in hands and knees, and she was doing an epidural in hands and knees, continuous monitoring. And the provider, or the midwife actually came in and said, like, you've been in hands and knees for a while. And like, whenever you get in this position, you move your hips back and forth, it kind of makes the monitor slip. And then we have to keep coming in and fixing it. And I'm really worried about your baby's heart rate. I don't want to miss it. I want to listen the whole time. And when it slips, I like miss it for like a minute and I have to come in and fix it. And I think that you should be on your back so that you hold still. Oh my God. And we can just listen to the baby continuously. And the mom was like, the logic, right? Like, she's so well educated. And she was like, well, I know that being in hands and knees is the best position to be if my baby's heart rate's going down. You're concerned about my baby's heart rate, so you want me to get on my back. But if I get on my back, that compresses on a blood vessel that runs behind my uterus, and that makes the baby's heart rate go down. So I really want to have a vaginal birth. And I'm sorry that the monitor slips, but that's just the kind of care that I need. I need you to keep coming in to fix it, or a nurse to keep coming in to fix it if needed. And I'll try my best not to move too much, but I have to stay in hands and knees because I want to do everything I can to help my baby do okay. And she had a vaginal birth, but it was like under threat of C-section so much. And she really advocated because she was educated and knew what to advocate for. Okay, next let's go to delivery. So as a birth partner, your role is to help with advocacy, invite collaboration by asking questions instead of just being like, okay, we'll do that thing, from fear, being like, okay, well, what are the benefits, risks, alternatives? Like, let's go through this, right? And to also try to protect and make sure that informed consent is intact. Informed consent means that you understand, and your partner, the person giving birth especially, you both understand the risks, benefits, and alternatives, and you know that you can say no. Those are two different parts. You understand the things, you know you can say no. So maybe someone will say, I think there's a problem, you need to do a thing, Pitocin, or I'm worried about the baby's position, or I'm worried about your progress, whatever. I want to do a cervical exam. And so the mom might be like, okay, you're worried about something. I have to do something about it. It's important that if the mom is clearly like, I don't know if I want to do this and feels conflicted, you remind the mom, you can say no. Saying no is an option, because we often forget in the presence of someone who's presenting themselves as an authority figure and saying we have to do a thing in a really vulnerable experience. But you cannot give consent unless you know that you can say no. If the option to say no isn't prevented, remind them you can say no. Maybe saying yes is the right choice. I don't know what the right choice is for you, but saying no is also a choice, and it's important that you know that. So I also want to give you this other tool around pushing, which would be to vocalize anything that you see to try to support informed consent to be intact. So let's say mom is lying on their side and they have their leg up. Maybe you're holding their leg up and they're like, I'm suddenly spontaneously pushing. I want to push, right? And so like the provider comes in and maybe provider's like, I'm getting my gloves on, and like sits down on the stool and like wheels up to the bed and says, oh, you feel like pushing? Okay, cool. I'm just going to check and see if the baby's there. I'm just going to check and see if you're 10 or whatever. And they just go to put their fingers in the mom's vagina. Oh, I see that you're going to do an exam. Honey, are you okay with that? Right? That's not informed consent to just put your hand in somebody. It's not okay. You can also say, wait, just say, stop, something like that. Just like say something to have the provider stop and then just say, wait a second. Did you say that was okay? Did you consent to that? I see you're going to do an exam, honey. Did you consent to that? And the mom might be like, like I'm going through something right now and I can't even talk. It's also possible that maybe the provider and the mom had a conversation that you missed. I don't know. I think that's unlikely, but it's worth appearing to be silly or like you missed something or you weren't paying attention to just shout, not yell, but just like make it clear with your voice. Like, hang on a second. I see you're doing that. Is that okay? Did we talk about that? It's like, it's so worth maybe looking silly just to say that, because a lot of the time, if something starts to happen to the mom and the mom doesn't, like, it was clear to you that the mom did not say yes to that thing, that you protect the mom from experiencing an intervention, even a cervical exam, anything as like simple as that, any kind of touch really that they don't consent to. Just because you're having a baby doesn't mean that your right to informed consent goes out the window. It does not. And it's so important that it stays intact. And some providers do a really good job with this and other providers do not. So what I want you to do as a birth partner is honor your intuition and listen to your gut. If at any point something is happening and you don't understand what's happening, you don't understand why it's happening, say something. Wait a second, can we just pause for a second? What is it that you wanted to do? Or what is it that you're doing? Just like say something, because often the partner will have a funny feeling and then be like, oh, they're the doctor, they know what they're doing, right? I shouldn't interrupt them. And our nervous system can kind of collapse on us in those moments because we feel so vulnerable and we're in the presence of the doctor and the doctor knows what they're doing. But no one has the right to put their finger in the person who's giving birth in their vagina without their consent. No one has the right to do that, or anything for that matter, any procedure. So I want you as the birth partner and the mom to both feel confident in everything that's happening, to both feel informed and confident and like I understand what's happening. So honor your instincts and honor your intuition, because if at any point you feel like I don't know if this feels right, probably the person giving birth also does not feel like something is right, or they might not know what's going on. I would also vocalize if you see instruments or scissors. I see you're picking up a pair of scissors. I see you're picking up some instruments. What's that for, right? Because no one should use instruments or an episiotomy on the person giving birth without their informed consent. It means that they understand what's going on and they know that they can say no. There needs to be a conversation about that. Even in an emergency situation, a provider should not just cut someone. That's obstetric abuse. They should say the heart rate is at 70 and there's this tight tissue and the baby is having a hard time coming. Can I perform an episiotomy? You could say that in about 7 seconds just to ask the question, I'm worried, can I perform an episiotomy, right? Like you can like say that quickly. And so even in that kind of situation where things feel a little bit scary and a provider picks up scissors, just say, wait, what are you doing? Is it okay that we do that, honey? I see you're picking up scissors. Is that okay, honey? I would just like probably do that really quickly so that there's the opportunity for informed consent to be intact. Yay, we are at our time. That was fun. It was so great to have you all here. This was such a great turnout. I could go over all of the topics I went over with you today, like I said before, for an hour or more. There's so much more to learn. I think as an advocate, really understanding all the communication tools for lots of different situations, in addition to having the full education on risks, benefits, and alternatives, is so important, because that's the kind of education that will prevent you from feeling backed into a corner around anything. So I invite you to keep learning. Thank you so much. Have a beautiful rest of your day, and we'll talk soon. Don't forget to check out the link to my free birth course in the description, and hit subscribe and follow along so that you can get access to all of my content. You've got this.